Hi everyone, my name is Sabrina Slagowski-Tipton. I'm the Managing Director at the Center for Public Deliberation, and today I'm going to talk you through the questions and a little bit of information about how to ask those questions. Question number 1 is, how has your housing influenced your health or the health of others in your community? And under each of these main question types, there will be several probing questions. So I'm going to go over those as well for question 1. The first probing question is, have factors like your neighborhood, the quality or safety of your housing, your sense of stability, or the cost of housing influenced your health? A second potential probing question is, what types of things would help you or have helped you maintain your health? Another question you may ask under this first question bubble is, what types of resources might help you in the future? You could also ask your participants, what barriers have prevented you from maintaining good health or accessing healthcare? And finally, for this first question bucket, are there any community resources you've tried to access that didn't work out? Question number 2, how has your health or access to health care influenced your housing or the housing of others in your community? The first potential probing question for question 2 is, what barriers have prevented you from maintaining good and stable housing? A second potential probing question is, what types of things would help you or have helped you maintain good and stable housing? Question number 3, how has the coronavirus pandemic and the economic shutdown impacted your health or housing? For question 3, one of the first probing questions you have an opportunity to ask is, what challenges are you facing right now that you weren't facing previously? Another question you have the opportunity to ask here under question 3 is, what types of help do you need right now? This probing question will help you potentially connect your participants to resources that they may not know about. You can also ask participants what has helped them or members of their community navigate this moment of social distancing, of businesses being closed, of people maybe losing their jobs. And finally, under question 3, you could ask participants about the challenges they're facing right now that they're worried might continue even after we reopen things. And question number 4, what are your hopes for our community? Since question 4 is related to future visioning and hopes for our community, the first probing question you could ask is just around what it might look like for everyone in Fort Collins to have those same opportunities for health and affordable housing. Then, to continue a little bit reflecting on the moment of crisis we're in right now, you can ask participants how they think we might be able to use this moment to create opportunities for better housing and health in our community, considering what's happening right now. And then finally, You can give your participants the opportunity to put in notes what they think city leaders should know as the City of Fort Collins plans for our future in relation to housing and healthcare specifically. As you can see in the process guide attached to this module, these are the 4 big bucket questions, and we have recommended probing questions within those 4 big buckets for you to use as well. Once you've asked all these 4 questions and several probing questions underneath, we will then ask you to solicit some optional demographic information from your participants. Our first demographic question is, how long have you lived in Fort Collins? If your participants don't live in Fort Collins, just make a note of what city or town they live in instead. Next, for those folks who do live in Fort Collins, we'd like to know where in Fort Collins they live. We don't need their address, just a general area of town or an intersection or something like that. Then we'd like you to ask your participants what gender they identify with. And please remember that if folks aren't comfortable answering these questions, they're more than welcome to pass. Then we'd like you to ask how your participants describe their own race or ethnicity. Again, this one is optional. Then please ask what year your participants were born so that we can try to get some age demographics as well. We would also like education demographics. So if you would please ask, what is the highest level of education you've completed? And finally, the city would like you to ask your participants what percentage of their monthly income they spend on housing. Some of you may be wondering why we're having you ask these demographic questions. Part of the Home to Health grant is making sure that we're engaging a wide variety of our community, and demographic information just helps us make sure that we're doing our jobs well. So please remember, these questions are optional, but they certainly do help us understand where folks in the community are coming from, what they have access to, and help us gauge our engagement efforts. That's all we have for the question training. Please make sure that you read through your interview guide, as again, it has those probing questions underneath the big theme questions that I went through in this video. Thank you so much for the time you're spending on this project. We know that you're providing a lot of great things for your participants. You're helping them with social isolation. You're helping potentially connect them to resources. And you're also helping us show the City of Fort Collins how they can help more effectively with issues surrounding health and housing. Thanks so much for your time. Be well and stay in touch if you need any feedback or guidance.